Did you know that seemingly harmless daily habits, those we often perform without a second thought, may be gradually damaging your knees after the age of 60? Persistent knee pain, stiffness, or difficulty rising from a chair could be more than just a sign of aging. It could signal early-stage knee arthritis. In this video from Golden Aging Health, I will explore 5 common daily habits that silently contribute to knee joint deterioration, explain how to correct them, and highlight scientific insights on promoting joint recovery without constant medication or invasive surgery. Knee arthritis remains one of the most widespread causes of joint pain in older adults. According to Harvard Health, chronic inflammation and repetitive stress are often the key contributors. If your goal is to preserve mobility, minimize arthritis pain, and embrace healthier aging, this video will provide valuable guidance. Before we jump in, don't forget to like this video and subscribe to Golden Aging Health, your trusted space for simple, science-backed wellness tips for seniors. Let us start with the first habit. It is something many people unknowingly do each morning. Habit number 1. Ignoring joint pain during short walks. Have you ever felt a dull ache in your knees after walking across the room or stepping outside, only to dismiss it as something normal or unimportant? At first, it might feel like nothing serious, but overlooking these small signs during your daily walk can gradually make your knee arthritis worse. It's one of those quiet habits that speeds up joint wear without you even realizing it. According to the National Institute on Aging, even brief discomfort in the knees could signal inflammation or joint instability. And when we repeatedly move through that discomfort without adjusting, it places continuous strain on the knee joint, increasing the risk of long-term joint damage, especially in older adults with knee osteoarthritis. Let me share the story of Miss Bernice, a 69-year-old retired librarian I once worked with. She used to feel light pressure in her knees while walking from her kitchen to her garden. At first, she ignored it, but within a year, she needed a cane. Her doctor later explained that low-grade joint stress had gradually worsened her arthritis in the knees. So, what should you do instead? Pay attention to short bursts of knee pain even if they seem minor. Use supportive indoor footwear. Stretch gently before short walks. And log when and where pain appears to track patterns. Experts from Harvard Health share that when we respond early even to mild signs of knee discomfort, we give our joints a better shot at long-term health. These small adjustments can ease inflammation, protect the cartilage that cushions our knees, and help slow down the silent progression of knee arthritis before it becomes disabling. That quiet kind of pain is easy to miss, but not all damage comes from movement. Some of the worst stress on your knees can happen when you're perfectly still. Habit number 2. Sitting with knees bent for long periods. Do you often sit with your knees bent at a sharp angle, whether on the couch, at the dinner table, or even during long phone calls? It might seem like a natural position, but sitting like this for extended periods can quietly strain the knees, especially in older adults with knee arthritis. Studies from the Journal of the American Geriatric Society show that keeping the knees in a flexed position for too long reduces synovial fluid circulation, which is vital for joint lubrication. Without regular movement, the cartilage doesn't receive the nutrients it needs, increasing stiffness and discomfort over time. When this habit becomes routine, hours spent in chairs that don't support your posture, it can lead to pressure buildup in the kneecap and the surrounding tissue. That pressure may not hurt right away, but over months or years, it can slowly worsen knee joint damage and limit mobility. Dr. Howard Looks, a board-certified orthopedic surgeon with over 25 years of experience, often reminds his patients that movement is medicine for the joints. Staying in a bent knee position too long limits blood flow and joint lubrication, 2 things essential for keeping knee arthritis from progressing. To support your knees and reduce silent strain, opt for chairs with firm, supportive seats that help maintain natural alignment and prevent sinking too deep, which can place added pressure on the knees. Keep both feet flat on the floor, with knees at a relaxed, slightly open angle and not tightly bent or tucked underneath. Shift your position or stand briefly every 20 to 30 minutes, even if it's just for a moment. This keeps fluid moving through the joint and helps prevent stiffness. These simple changes might seem small, but over time, they can make a meaningful difference in reducing daily discomfort and protecting your knees from further wear. Do you ever feel stiff or achy after sitting for too long? Let me know in the comments, what do you do to relieve it? Of course, posture matters, but in many cases, the real damage begins on your plate, not only in your chair. Habit number 3. Eating inflammatory foods that fuel knee arthritis. Mr. Leonard is a 70-year-old jazz pianist I recently came across, and his story really stuck with me. Every morning, he'd sit at his piano with a cup of sweetened coffee and buttered toast. Music was his comfort, but what he didn't realize was that his breakfast routine was quietly making his knee arthritis worse. Over time, he noticed his knees stiffening whenever he pressed the pedals, and the swelling would linger after each session. Eventually, after speaking with a rheumatologist and a dietitian, he decided to make a few changes, cutting back on sugar, adding more omega-3s, and focusing on whole foods. Just 2 months later, he said his knees felt 10 years younger, and he could play again without that nagging pain. Mr. Leonard's case is far from unique. According to the Mayo Clinic, diets rich in refined sugar, processed meats, and fried foods increase systemic inflammation, which worsens symptoms of knee osteoarthritis and accelerates joint damage in seniors. High levels of C-reactive protein, CRPAN inflammation marker, often found in people with poor diet quality and chronic joint pain. To support joint health through daily meals, start by gradually cutting back on sugary drinks, pastries, and white bread foods that quietly raise inflammation levels in the body. Processed meats like deli ham, bacon, or salty packaged snacks should also be limited, as they've been linked to increased joint pain in people with knee arthritis. Instead, try shifting toward whole grains, leafy greens, fatty fish like salmon or sardines, and natural anti-inflammatory ingredients like turmeric or ginger. These foods not only help reduce swelling but also nourish the cartilage and tissues that support strong, pain-free knees over time. Sometimes, it's the habits we trust the most, the ones that feel safe or protective, that slowly reduce our knees' natural strength. Habit number 4. Relying on knee braces or supports. Wearing a knee brace often provides a quiet sense of reassurance, like a layer of protection that makes each step feel safer. For many older adults, it becomes a familiar source of comfort. Yet it's important to recognize that what offers external support does not always contribute to internal strength, particularly when it becomes part of one's daily routine. Knee braces, when used appropriately, can help stabilize the joint after injury or during acute flare-ups of knee arthritis. However, long-term, unsupervised use may lead to unintended consequences. According to guidance from the National Institute on Aging, over-reliance on external supports can cause the surrounding muscles, especially the quadriceps and hamstrings, to weaken over time. When support comes from the outside, the body stops working as hard from within. What's often overlooked is how muscle inactivity can quietly erode stability and balance. The brace becomes a crutch not just physically, but psychologically, and before long, walking without it feels unfamiliar, even risky. That's why support must be paired with intention, rather than reaching for a brace during every routine task. Prioritize strength-building movements approved by your provider. Use braces sparingly, and with a weaning plan, rebuild confidence and movement through gentle practice. Discuss long-term use with a physical therapist. I'm curious, have you used a knee brace before? Was it helpful, or did you feel more dependent over time? Share your thoughts in the comments. I'd love to know how others are navigating this. Before we wind up, it's important to explore one final habiton often overlooked part of the morning that may quietly determine how well your knees recover throughout the day. Habit number 5. Sedentary mornings that delay joint recovery. Many people with knee arthritis wake up feeling stiff and unknowingly make it worse by spending too long in bed or moving too little in the first hour of the day. A quiet morning may feel restful, but physical inactivity after waking can prolong joint tightness and delay the natural reactivation of the knees. Even actor James Garner, who openly managed knee arthritis for decades, followed a consistent morning movement routine to keep pain in check. He emphasized the importance of gentle activation, using light stretches and short walks to wake up his knees before beginning the day. His routine wasn't just personal, it's one that modern research strongly supports. The Arthritis Foundation recommends light stretching shortly after waking to increase synovial fluid movement and reduce morning stiffness. When joints stay idle too long, especially in the early hours, cartilage lubrication decreases, and surrounding muscles remain disengaged, setting the stage for lingering discomfort. Beginning the day with gentle, low-impact movements such as seated leg extensions, ankle circles before standing, a short walk around the room, or light knee bends while holding onto a chair can help ease morning stiffness and gradually reawaken the muscles that support the knee joint. Each simple movement becomes a quiet reminder to your knees, teaching them to trust again, move freely, and support you with steadiness throughout the day. Knee arthritis doesn't happen overnight, and neither does healing. But every choice you make today, no matter how small, can shape how well your knees feel tomorrow. Let's quickly recap the 5 habits we've covered. Ignoring joint pain during short walks, sitting too long with knees bent, consuming inflammatory foods that damage joint tissue, relying too heavily on knee braces instead of rebuilding strength, starting your mornings without gentle movement or activation. Each of these may seem minor in isolation, but together, they can quietly chip away at your joint health day by day. The encouraging part? All of these habits can be reversed, and you don't need extreme treatments or invasive procedures to get started. What you need is awareness, consistency, and a willingness to tune into your body. Simple, thoughtful changes like stretching before you stand, choosing nourishing meals, or walking with confidence instead of dependence can help you regain control. And with time, they may reduce pain, restore mobility, and even slow the progression of knee osteoarthritis. If you found this video helpful, don't forget to like, share, and subscribe to Golden Aging Health. We're here to help you stay strong, active, and independent no matter your age.